All right, good afternoon, everyone. Thanks for joining us. Happy Friday. Hope that you're having a great Friday. Today, this month, we've been focusing on some of the work that our folks at NMQF have been doing. And so this webinar, we're going to focus on some of the work that our team at the SHC is leading. So without further ado, the president of SHC, Dr. Laura Lee Hall.
Thank you, Brandon. Can you all hear me? Great. Welcome everyone to our favorite Friday lunch hours. So pleased those of you who are attending the session, and I look forward to us having a conversation with you after we talk about some of the work we've been doing. I am, as Brandon said, the president of the Center for Sustainable Healthcare Quality and Equity, and we wanted to feature our work that related to building up health equity champions, of course, focused on COVID vaccine right now, but we'll be moving back into flu vaccine and other areas in the coming months. Let me introduce the panel and kind of give you a sense of what this is about. So I'm just going down from the list that was in the invitation. We are so honored and delighted to have a partnership with Ms. Helen Arteaga. She first started working with us at Plaza del Sol, a federally qualified health center she started in Queens, but she has gone on to become the chief executive officer at NYC Health and Hospitals Elmhurst. And she is a force to be reckoned with in terms of promoting and improving the health of people in her community and now nationwide. We are deeply graced to have the Reverend Dr. Terrace King, pastor of Liberty Grace Church of God in Baltimore. You know, his resume is so long, I can't even take the time to describe it to you. But let it be known, he has worked in government, he is working in the church community, and he has been doing one hell of a job, if I say so, in promoting vaccinations and health among the Black community in Baltimore. Thank you so much, Reverend King. Shanina Knighton, who is a PhD nurse, comes to us from Case Western Reserve University. She is an outstanding not only researcher, but she has been working with us to create culturally relevant and sensitive infographics having to do with vaccination, flu, and COVID issues in general. She's just a distinguished person when it comes to communication. And she's really going to talk to us about how to reach those of us who are not in social media land or even, particularly internet accessing or competent. So thank you, Shanina, so much for all the work you've been doing. We're going to get started with the newest staff member at SHC and NMQF, Kristen Hobbs. She is a senior project manager of our efforts and is just an extraordinary young person who is managing a number of our quality improvement projects. And I'm going to ask Kristen to get us started and just talk about the opportunities we have in terms of supporting you all in your work in doing promoting health equity and COVID treatment and vaccination. Thank you, Kristen.
Thank you, Laura Lee. I'm so excited to be here, and thank you all for joining us today. Well, hello, everyone. As Laura Lee said, I am Kristen Hobbs, and I'm delighted to talk about our NMQF Health Champion program and how you can help protect your community from COVID-19. So what is it? What is an NMQF Health Champion? So an NMQF Health Champion is any individual who has the determination and enthusiasm to address a health need or improve a health issue in a clinical area or public health intervention. Now, they are determined to promote equity in COVID-19 vaccinations in Black and Hispanic communities through both culturally appropriate and culturally relevant communications, education, and training. Now, you might be asking yourselves, Why does NMQF need you? Why are we looking for you to help us? Let's take a look at the data and ground ourselves to really talk about that. Now, CDC data as of 6 a.m. Eastern on Wednesday, May 19th, 2021, so that was just 2 days ago, shows us that the percent of the total US population who have been fully vaccinated. Now that means they have received either 2 doses of the Moderna or Pfizer vaccines or 1 dose of the Johnson & Johnson vaccine. That number is still just 37.8%. Now the way that the CDC collects these data is by collecting data on the number of doses administered, not the number of people who are officially 2 weeks post their last vaccine dose in a 2-dose cycle or a 1-dose cycle. And that means that the percent of people who are fully immunized is likely slightly lower. And as you can see here on the chart, the most vaccinated group is our population of people 65 and over. Now, they have had access to the vaccines a lot longer and were prioritized in the first group rollout. So keep that in mind as we continue to talk more about the data. So these data represented here show the racial and ethnic distribution of fully vaccinated people. Please note that the race and ethnicity data were only available for 60% of those who are fully vaccinated. However, even with only 60% of these data, we can still see a large disparity in COVID-19 vaccinations that exists between communities of color and the white non-Hispanic population. These numbers are not surprising to a lot of you who've joined us today on the webinar, and it's probably why you are here. And since we can clearly see that communities of color are lagging behind in vaccination uptake, we have to create and prioritize a plan for vaccine equity that includes advocacy and education on the COVID-19 vaccines from people like you who are representative of your community. Good public health practice shows us that building trust in communities and moving people from contemplation to action is really more successful when trusted leaders in the community serve as advocates. And lastly, we can see disparities in age groups of people fully vaccinated as well. So data for this demographic was available for about 92% of people fully vaccinated. Again, we have to keep in mind that vaccinations have just recently opened for our younger populations. And we must remember that there are other reasons for vaccine hesitancy in younger people and in communities of color. Let's talk about that really quickly. In order to gain trust, we have to keep all of these things in mind. We know that vaccine hesitancy in our communities is not simply a matter of being an anti-vaxxer, right? There are several other reasons for this. For one, communities of color and younger people have a healthy mistrust of medical and public health systems. And when I say healthy, I mean we have to take into account the historical injustices that have been perpetrated on the backs of communities of color and the racism that still persists in healthcare today. Secondly, people just have questions, right? People deserve to have their questions answered before getting a vaccine so that they're able to make an informed decision. And third, people have a fear of several things. They have a fear of adverse side effects from the vaccine. They have a fear of still getting COVID-19 after being fully vaccinated, which is what we call breakthrough infections, right? And there are other fears as well. And so regardless of whether we know that these fears may be exacerbated by misinformation or disinformation, we have to be aware that these fears exist, and we have to offer objective evidence-based information to combat them. And that's where you come in. That's why we need you. No matter who you are, no matter what your profession is, no matter how well versed you are in social media, no matter how well versed you are in disseminating public health communications, everyone can help. And so how do you help? First of all, I'd like to note that if you do decide to become an NMQF Health Champion, our team will provide you with all of the resources, toolkits, and communications training you need for you to be successful. And here are a few examples of how you can actually act as an NMQF Health Champion, what you can actually do. You can host an IG Live to answer questions about COVID-19 from your followers. You can also do this on Facebook. You can actually make social media posts. So if hosting a live is not your thing, if you're just not ready to do that, you can simply make social media posts that we've already created. So we have been working with our communications team to create Twitter, Facebook, and Instagram posts. We already have images, we already have graphics, we already have GIFs, videos for you to just copy and paste, and language, suggested language as well to go along with that. You can also host a town hall with members of your community, a virtual town hall, if that's what you're comfortable with. The benefits of a town hall is really to engage in a two-way conversation. It's not just people asking you questions and then you answering. You really get the opportunity to have honest feedback and honest dialogue with your community. Or you can create a video like I did. Hi, everyone. My name is Kristen Hobbs, and I work for the Center for Sustainable Healthcare Quality and Equity, a part of the National Minority Quality Forum, one of the nation's leading organizations promoting health equity. And we need you. COVID-19 continues hurting our communities disproportionately. We need your help to spread the word to your families, friends, faith members, and everyone else in your community about COVID-19 vaccines by becoming an NMQF Health Champion. You can sign up at bit.ly/NMQF Health Champion. And that's just one example of the type of video you can create. Our friend Arthur Moats at the Pittsburgh Steelers also created a video. It's included in our social media toolkits. And so please think about joining our NMQF Health Champion team today. We'd love to have you. The link is detailed here, and we'll also drop it in the chat so that you can click it and directly go there to sign up today. And before I go, I'd like to promote some of our upcoming events, insert my shameless plug here. On May 27, 2021, we will be working with Reverend King and another mega church in Baltimore, Maryland, for a Facts, Faith, and Fears event, a conversation about COVID-19 with millennials and Generation Z. And on June 2nd, 2021, we will be hosting a vaccine conversation with high school youth in Queens, New York, called Your Best Shot. And on June 25th, 2021, we will be hosting a Spanish-speaking virtual event for vaccine education. So please look out for everything we have going on at NMQF SHC for COVID-19 vaccine education. And I'd like to thank you for joining us. And I truly hope that you enjoy the rest of what we have for you today.
Thank you so much, Kristen. That was terrific. And you can see what a great partner she is on our team. I want to kind of pitch the ball, if you will, to Reverend King next, because he can, I think, provide you a tremendous example of a partnership where he became a formal NMQF SHC champion and has grown his activities to expand much further than that, which I think is a great opportunity and lesson for us all. Reverend King.
Great to be with you, Laura Lee. And I just want to say that was great, Kristen. She's such a wonderful talent. That was just refreshing. So in Baltimore, I guess we've been working on vaccine hesitancy issues for over a year now. We really started last year with the flu season. And I would leave certain steps that we've taken that could really be of benefit, hopefully, to our audience. The first step in our process, and this was about flu vaccine, but remember, during last flu season, COVID was on the forefront. So the backdrop was people really had an issue with the flu vaccine because they thought we were slipping the COVID vaccine in to flu vaccine. So that was the backdrop. Now I'm going to give you the results on the forefront. At the end of the day, we were able to work in partnership to raise the flu vaccine level by 15% in Baltimore. Who was this with? It was both myself as a representative of the interfaith community, which really began with pastors in the Christian faith, but grew beyond that as we moved to COVID to an interfaith effort that included several of my friends who are rabbis, both Orthodox and unorthodox, and my close friends in the Nation of Islam. So you have to get a picture of almost a United Nations front of religious leaders across the board, Catholic, non-Catholic, Nation of Islam, Arabic Muslim, and rabbis, all in a group together, working with the health department of Baltimore and Johns Hopkins University. And I will say to you, working with that international group for vaccines, and particularly Hopkins, that was a major issue because there are several hospital entities in Baltimore, but they are the biggest without question and most recognizable. And I'd start out and leave you with this in terms of that word, Laura Lee. Step one, recognize, and that was my process. Recognize us and understand your intent for recognizing us, because many of the African Americans in Baltimore had issues with the healthcare community recognizing us with COVID, which had never recognized us in terms of our diseases before COVID came along. People were sick before COVID. They are sicker after COVID. And the fact now, for the first time, that you're coming at them with a vaccine, I had to be real in terms of my purpose. Second part, relationships. We build the relationships through agreement and disagreement and honesty about the things that Kristen just talked about, both historical problems in healthcare and current problems in terms of unequal treatment. Next, if we can agree to disagree and work together, we can finally get to respect. And then lastly, results. You cannot come into a community or city like this and go from recognition to results. There is a process, and we were able to work through that process, and we're continuing to do that now in leading the interfaith effort for Baltimore and setting a model, we believe, for the country that has to do really with driving to empathy between the religious community, the healthcare community, the pharmaceutical community that we've brought into prayer services where they're not in charge, but the ministers, I'm in charge, and will set the culture, context, and respect for conversation. So that's what we've done, and it's worked very well.
And continuing to grow.
Yes, it is. Yes, it is.
I would just note to the folks who are with us today that while everyone isn't a Reverend King, many of you are just totally able to bring the message and the communications and the services to your community. But you don't have to fly without a net, because I assure you that Reverend King, myself, Kristen, everybody on this call and others will be glad to help you.
Absolutely.
So I want to lob the ball over to Helen now, because she's been a champion, well, her whole life, but she's been working with us on quality improvement programs and communications that promote flu vaccinations, and now has this tremendous high school activity coming up on the COVID vaccine. So take it away, Helen. Tell us about your work.
So good afternoon, everybody. By the way, Kristen, I need your PowerPoint skills. I mean, COVID is such a complex issue, and the way you just laid it out and the video, I was like beyond impressed. I was like, in my head, I was like, must steal shamelessly. So kudos to you. So again, my name is Helen Artega. I am the CEO here at Elmer's Hospital. But not so long ago, I was the AVP of the Queens Network at Urban Health Plan. And this is kind of where my work began in advocacy of flu, right? Because often people forget that COVID is a virus coming from the flu virus. And one of the things that we try to do in our community was how do we tell people that the flu vaccine was important? And there were two important things that we discovered doing the work with Laura Lee. One, it was an issue of cost. And then there was an issue of access. Not so much that there wasn't access to the flu vaccine, but like how quickly could our patients and our community members get it? And working with Laura Lee, our focus groups, a lot of like PDSAs and performance improvement work came in. We actually went from, we were about, I want to say we were about like 56% getting the flu vaccinated every year among our population 18 and older. And when we finished our work about almost 2 years into it, we were about 76%. And the reason why I kind of give you that background, because then here comes COVID. COVID hits us really hard in this community. Corona and Jackson Heights were not only the epicenter of the coronavirus, but we were the epicenter within the epicenter. When you looked at every map the governor showed of New York State, or the mayor talked about where the hot zones were, Corona and Jackson Heights was red and Corona was like fire red. Because it was such a big pandemic, it spread here so wild. No surprise to anyone who lives in the community, we have huge infrastructure issues. Health disparities is a huge thing. We don't have enough providers or enough access to healthcare to begin with. So with the work that we already started doing with the flu vaccine, believe it or not, it did help us when the COVID vaccine kicked in. We kind of laid the groundwork already of like, okay, now we have the vaccines. Let's make sure that the cost is not an issue. One of the things that we spread out a lot everywhere, anywhere, anybody that could hear us, is that the vaccine was free. Because cost in this community is a big issue, because one of the things that we don't have in this community is access to insurance. Kind of talking about what the Reverend said about recognizing us. For our community, it's something that we need to recognize. Most of our communities are migrants. We do not have a legal status in this community or in this country, so hence we are considered uninsurable. And I say we because I do have family members that don't have access to insurance unless they pay for it themselves. So cost is a huge issue. So when the COVID vaccine came in, saying that it was free was super important. And then the issue of access, like how do we make sure that people get access to the vaccine in a most efficient way? We didn't want our patients either at Plaza del Sol or at Elmer's Hospital to be waiting long lines. I don't know if you guys remember, but in January, it was freezing outside, and I thought it was unacceptable to have our geriatric community. I don't think 65 is geriatrics, because now I'm getting close. So I'm like, I don't think 65 is old. But we had people who were like 70, 80 on these long lines. I found it to be unacceptable. And here at Elmer's Hospital and at Plaza del Sol, one of the things that we made sure is that we did our scheduling correctly, where our patients were not only socially distanced, but were in and out of our systems quickly. And I am very proud to say that here at Elmer's, really early on, we never had long lines. Our cycle times were anywhere from 30 minutes to 45 minutes. The rate limiting step was all the paperwork that they had to fill out from the CDC in New York State. And we worked really hard on making sure those got online. We made sure we had like navigators and community health workers on the line. So by the time the patient or the community member was ready to get the vaccine, all the paperwork was done. So that really cut a lot of our cycle time, which I think was the experience that we experienced and lessons learned that we got from the flu vaccine. I think what COVID-19 did bring us something new was how do we give information? Kind of like the Reverend was saying, Christine was saying, the information on COVID, because it was so new, there were so many fears, there were so many misunderstandings of what COVID vaccines would do. Does it make you sterile? For women, it'll stop making you having babies. There were so many crazy, there was a chip on it. There were so many wild things that people would tell us on why they wouldn't get the vaccine. But then going back to what the Reverend said, you had to recognize the person's concern, not judge them. And I think that was another lesson learned. As well educated and public health advocates, we know the science, we believe in the science, but we kind of have to meet our patients where they're at. If they believe there's a chip in that vaccine, okay, how do we help them work out this idea? Not saying, well, that's dumb, not making fun of them, and kind of saying, okay, if you think there's a chip, why is that scary for you? You know, you think the government's going to be following you around? Let me tell you why the government is not going to be following you around. You know, not that you're not important to our community, but the government might not be thinking, you know, that your whereabouts are really that important. You know, kind of breaking out those fears and kind of like leaning into their fears and giving them the evidence of why those fears are not evidence-based and why those fears are kind of illogical. So I think that was one of the things in how we approached the vaccine here at Elmer's. And I have to tell you, that type of framework really made our vaccine centers here a success. I have to say, not only was our cycle time down to like 30 minutes, there was usually almost never a line. The lines always moved, but we did high volume. I wish I could take a picture. I didn't think of putting it. We only have about like 12 stations to give out vaccines, dose 1. And we would do 800 vaccines a day from 7 to 7. So you knew not only did we have to be efficient, we had to be welcoming, and we had to be understanding. So to do that in such an efficient manner, I think it was a lot of the lessons learned from what we learned in doing our flu work. And I think that's also what was the success here. Like we met with where our patients were. If they were scared, they needed a hand holding, they were like, can you hold my hand? Sure, let's hold your hand. Let's hold our hands together if you need. I feel like if I get the vaccine, I'm a fainter. Okay, we're gonna bring an extra nurse in the room just to make you feel safe. Like we did all those little extra steps. And I think the word spread that here at Elmer's, we met where the patients were at, we met where your fears were at, and we provided the framework. And I think that's why people kept coming here to get vaccinated. I could tell you another perfect example, because I try to go downstairs quite often just to make sure I get the feedback from our community. There was a patient who came in as an adult. She came in and she was like, is it okay? I know you have an EpiPen. Can I just hold my EpiPen while you're giving me the injection? Because I know exactly when I get really bad allergies, I know exactly what I need to go. So I don't want to use your EpiPen in case I get a reaction. I said, no problems. My nurses said, no problem. You want to hold your own EpiPens? No problems. So much now that now you can do 12 and older, she brought in her twin sons to get vaccinated here. I mean, that's the type of trust that I don't think you can, you can put it on a flyer, but it's that one-to-one. It's recognizing our community, recognizing their fears. And I couldn't agree more with the Reverend and Christine and the work and Laura Lee, that it's about relationship building, is making sure that you're connected to your patients and your community. And I think once you do that, there's nothing we can't overcome together. And I think that's the success that we've had here at Elmer's and the work that we've done at Plaza del Sol. I think those have been the frameworks of what we're doing. And I am positive that type of framework and lessons learned are really going to help us get out of this pandemic.
You know, that was so beautiful, Helen. And you hint towards what I'm going to ask you all to comment on later, is something as little as a one-on-one touch can, not only make that particular interchange a positive one, but it breeds the future of trust. So I'm glad you don't have to be the CEO of a healthcare provider organization to make a difference. Before I asked Shanina to talk about her wonderful kind of outreach and patient education, I want to give you a moment, though, to talk about this communication side of what you all are doing. So you have been successful in implementing the care delivery, but now you're going after teenagers. Tell us about that.
So we do try to get influencers to come. We had AOC come and do a bid on getting vaccines done here at Elmer's. We are having a youth day on June 6th, and we're trying to get some more influencers to come and do videos. And we're trying to get youth to come and be their own ambassadors. We just literally enrolled someone. So there's a youth health council here in New York City, and we got the chair, who's this young, vibrant young lady, to come and be an ambassador as well. And I think not only peer-to-peer is also important in spreading the word, because again, it's recognizing where our community is at, but also hearing, from the people they admire. I think the fact that Congresswoman Grace Mann and Congresswoman AOC coming and saying that the vaccine is cool and safe and come, be part of the solution and become heroes as well. I think that messaging is important to the youth, especially after the year they've had where they've been kind of like in lockdown. They kind of feel like helpless. Like, what did they do the last year besides go to virtual school? And I think this gives them a way out to use that energy in a positive way.
That's wonderful. So Shanina, you are an expert communicator about health, but there are some people who are not as hip as you and others in terms of using the technology, but not for lost, right? You can do something too. Can you tell us about reaching these people?
Yes. So it's interesting because prior to COVID, my science, my work, so I'm a nurse. And during 2009, when we had the H1N1 pandemic, I was on the front line. I was swabbing people inside of the facilities. And one of the things that struck me was that I was also pregnant and having to work in healthcare. And so if you can imagine, we're taking all of these measures to be able to protect patients and protect us from spreading germs in between patients. But the question came is, how are the patients protecting me? And so what that did is that actually spawned a career of research where my efforts have been focusing on infection prevention self-management of patients. When Ebola hit, when COVID-19 hit, anytime a nasty bug comes around, I typically am still working on how can we show individuals how to prevent infections. And so many don't know this, but infection preventionists, it differs from an epidemiologist, it differs from someone that works, let's say, in public health, because we're specifically focusing on how do we stop the transmission of bugs. So not how do we cure bugs, how do we treat bugs, how do we stop the transmission of them. So this may literally be me in a lab putting literally C. diff spores on my fingers and figuring out what products best kill them. It could be me out in the actual hospital setting and saying, okay, does this gown work better than this gown? So if you can imagine, if there is a knowledge deficit or something that is growing in healthcare, of course the community doesn't know. That means that the community wouldn't know anything or know much about infection prevention. So I essentially, when everything happened, understood that when the media said, clean your hands, when they said physically distance, when they said wear masks, when they said go get tested, when they said go get vaccinated, me being a Cleveland nativer, which of course is one of the poorest cities in the United States, knew that that message resonated different. That meant that, okay, follow CDC's website for guidance, follow WHO's website for guidance. That meant we're talking about individuals who possibly can't read the small font on a telephone, that has to do countless scrolling to be able to put together a message. That means individuals that will have to know how to go to these sites and actually navigate what it is they're looking to find. And not only just look at it there, but how do you aggregate that information and say, how does this apply to my real life? So it might say, okay, clean my hands and make sure you're doing this when you're going out in public. But what happens when I'm going to the doctor's office? So essentially what I did is I took my science, so understanding the facilitators and barriers and what was happening in healthcare facilities, the practices, because just because we're a nurse and I might help someone with their surgery or help someone after their congestive heart failure exacerbation, it doesn't mean that these are individuals that don't come in with the MRSA infection or don't come in with some other bug that we need to stop transferring in the hospital. So I took those same exact practices and I started to apply them in the community into people's real lives, helping them to be able to see themselves in infection prevention. So I literally would go out. So I started out with writing these lists down. So when someone needs to clean their hands, it might be 3 to 6 seconds. 3 to 6% that only cleans their hands correctly. So that means, okay, what does 20 to 25 seconds mean? Someone may say sing happy birthday, but are you meeting the thumbs where you meet the hands? So I took this information out in paper form, talked to people in the community. I'm talking about literally, yes, even during COVID, talking to people outside. Hey, can you read this really quick? Do you understand what it is that I'm asking, or what part might have hung you up? And I'm talking about challenging concepts that I'm then trying to break down into something that would be more simple. I then created with Janine Burns, so she's a graphics person from See Your Words, what we call infographics. So these infographics then help individuals to think about different aspects of COVID. So when we're talking about hand washing, so I'm gonna put one up. So this one right here, we actually put these infographics on rings. Did an effort where I looked for grant funding. So of course there's the scientific funding that supports my research, but this was different. So it was going out and getting a community grant and saying, you know, I need support with being able to produce these and being able to print them up. We're going to do porch drops. So we intentionally took these, and now they contain COVID information. So they contain COVID information about the COVID vaccine. It actually includes an infographic on the clinical trials process just in itself. It includes information about helping people to understand that the vaccine, just like the mask, just like anything someone else would use that we've been emphasized with during this during this time, it's their tools. So they are tools in our toolkit. One of them does not replace the other. And unfortunately, the messaging that comes out has us under the impression that this vaccine is going to be the silver bullet. But when you explain to people in the community and you're actually taking them this information and saying, this is why this is important and this is why these things need to work together, it's much more better than just telling them this is why you should take it. And I would say having bias. So I have to check my bias when I'm talking to individuals. So not saying, well, I think you should take this vaccine because, but it's helping them to understand, do you even really understand what vaccines are supposed to do? There's really this misconception that they cure people. So when I'm having that conversation with individuals and I take it back to the conversation about chickenpox, I oftentimes remind them when my parents were around, again, it was the calamine lotion and it was the oatmeal baths. For us, it was the chickenpox parties and it was the calamine lotion, just to soothe the itching. Now my kids, they don't ever have to worry about getting chickenpox and the ugly scars because there's the chickenpox vaccine. And so I remind them that the vaccines are to help us to not have the severity of symptoms that we would encounter and to be able to build up an immunity. So when I oftentimes hear conversations about, oh, well, why would I take that vaccine and I can still get COVID? Yes, you can still get COVID, but is your case of COVID as severe as it could have been had you not taken the vaccine? So there is this pros and cons that I have to do. I'm often addressed about the ingredients in the vaccine. And I remind people, your meat is probably on a better vaccination schedule than you are. So I remind them of that. I remind them that the FDA sprays viruses on lunch meat just so that way they can prevent listeria. So when you help people to understand these concepts and that all of us are connected to what it is we eat, we're connected to what it is we take. There's emphasis around like, oh, well, this is an emergency use authorization. And I have to remind them, do you realize how many times your doctor came to you with the blood pressure medication and said, oh, you know what, there's this new drug on the market, and I think that it can help with your blood pressure and help with your diabetes. You're not saying, oh, wait, I'm enrolled in a clinical trial. You're actively actually saying, you know what, I'm interested in lowering my blood pressure, so I'm going to take that med. So there's so much emphasis right now on where we are with this vaccine that I don't think that we're doing enough to help people understand what the clinical trial process looks like, and that many of them already technically are enrolled in them because they trust their provider. And so how is that trust for that provider to lower your blood pressure any different from this vaccine? So when I'm out in the community, I give the examples, I talk about the conspiracy theories, I help them to really understand. And this is just, naturally as a nurse, but also too, as someone that's in the community, as someone that still has family members that are going to be plagued with chronic conditions, they still run through our family, so I'm not exempt. That's the one thing we can't buy is health, right? So I try to remind them and help them to understand that I want to hear the conspiracy theories. I want to hear all about the craziest things you've ever heard, so that we can talk through them, so I can help you to understand logically. The problem is, though, is many of us, and I'm sure every person on this call right now is overwhelmed, because as much as we want to do to reach one, teach one, and have that individual conversation, we are challenged because we have to do a lot in a little bit of time. And so with the messaging that we're using to spread, I have to make sure that we're capturing these populations. I'm in the vaccine pod, so I'm actually giving the vaccines. I'm actually checking up on people on a regular basis. So this is a part of my work, but it also means that while I'm encountering that person that's right there on the brink of taking it and not taking it, it's helping them to understand the situation and not necessarily what I did or what I do. And I think when we can check our own bias, then we're in a much better position. So that has been successful. I've also been collaborating with individuals in the community about the actual infographics themselves. So they'll print them up and they'll pass them out to individuals that they're educating about the vaccine. Some of them are even holding vaccination pods. And so this is points of dispensing for many that may not know. So it's where people can actually go and get vaccinated in a mass site. So we've been doing about 1,000 a day. And so with that information, it's, hey, we're going to give you this information about the vaccine, but these are reasons why you should still continue to wear a mask. These are reasons why you should still continue to practice hand hygiene. These are reasons why you should now have a primary care provider, because if you had COVID, then you want to make sure that any of those residual effects are not going to affect you in the long term. And so I think that as we continue to share messaging, remembering the individuals that are not necessarily technology savvy or on the computers, but saying to ourselves, how do we touch people in our community that may not have those resources, or let's say that they do? I come with the assumption that no one has access, and that's how I approach it. Because we know that with the click of a button, we know with the real quick tweet, something can travel to 1 million people and it can be the wrong message. So I function with the mindset that nobody has access to technology. And I make sure everyone has the same information instead of pinpointing out who may have it or who may not.
What a great communicator you are, an educator and healthcare provider. Thank you so much, Shanina. So we're going to go now into a Q&A and a discussion period. One of the questions we got in advance of the program had to do with how can a member of the community or a nonprofit organization at the community level, how can they hook up with healthcare providers so that they're not just having conversations and trying to share good information, but they can then close the loop? And I guess, I mean, I think everyone on this panel has experience with that, but I'm going to kind of give it to you, Reverend King. How do you get from communicating to really helping them get to the immunization location?
So I want to say a couple things as I go into this. I want to know, firstly, what an excellent job from my standpoint has been done already by the other panelists. This is a great crew you pulled together, Laura Lee, and this has been insightful. I also want to note, of all the speakers, and they were just great, that the Baptist preacher was the most succinct. This is rare to not have you stop me in the midst of, I mean, this has never happened before, where you haven't cut me off to say enough is enough. Other speakers, they were absolutely great. And I think whatever town halls and discussions we have before, some way, somehow, the speakers that you have here today need to be a part of that process and upfront. So let me just talk from the perspective of both a former executive in federal government from a health perspective, working with hospital and other entities across the country to a guy who's working at a local level now. I think a big part of this is how you describe yourself and seeing yourself through the language of the healthcare industry, through hospital administrators, so that when you describe your value, just understand what's going on across this country. There is a tremendous push right now with this administration to drive hospital systems towards community-based initiatives. And if you can describe yourself in a way that hospital administrators and others see your value not just as a spokesperson, but as someone who can build an effective message with them, not just articulate what they say, not just build the trust in the way they say. You know the community. You know the needs of that community. You're aware of their issues and fears and concerns. And when you deal with the folks in business across the line, that has real value. So describe yourself in that way has been extremely important for me in terms of building that success, even with Hopkins, because I'm letting them know, not in a make you feel guilty way, but to understand from an ROI way, from a return on investment way, the investments you put into vulnerable communities help you. And that has been critical, because I'm not just speaking to the RN who's very important or to the doctor who's very important. I'm speaking to that chief executive officer. And I know how he or she thinks because I've driven programs in that direction. And they're looking at it not only, unfortunately or fortunately, from a clinical improvement perspective, but they're also looking at their bottom line.
That was really astute, Reverend King. Thank you so much. And so, Helen, you're looking towards your bottom line, right? And you know, part of why you've been selected to lead this big organization is that you know the community value.
Yeah. No, and and like Reverend was saying, we as CEOs, we have to look at our bottom line because so many people depend on us, right? I wish I could give everybody free healthcare. That would be universal healthcare, which would be great, or a single payer, which would even be better. But unfortunately, the game hasn't gotten there yet. Hopefully with this new administration, we will get there. I think we have a good chance of becoming a single payer, and that will help reduce costs, right? Because one of my main things is not only making sure that I make payroll every other 2 weeks, because I take care of almost 5,000 plus families here at Elmer's Hospital. And not only do I want them to make a good impact, a good income, but I want them to have the right impact in the community. And I believe in education and training. And when you do one training class for 5,000 people, that's like $1 million investment or more. Or you want to try to give people raises, that's actually like a $13 million investment. And I can't do those things if I'm not making sure we're balancing our budget. So sadly, it's that weird like balance of trying to do what we need to get done and keep our doors open and making sure our community still gets served. But I think that's why you get smart people around you and you start working, because, and I think the biggest misconception of healthcare that people think like, oh, healthcare is a social thing. Unfortunately, in the US, it's not. It's still a business. The people who pay us are the managed care companies, and managed care companies are for profit. They're not public systems. I think it's crazy that some of these managed care, you talk about like who's making a lot of money. Some managed care companies, their CEOs make $16 million a year. One CEO of a managed care company makes $16 million. That's like a whole unit for me here. So, and until the game really changes and there's policies put in place, I think, a lot of the administrative costs that come through hospitals, we're going to have to still keep doing that, enrolling and checking insurances, and, how one payer pays me this way and the other one doesn't, or you deny, you might have insurance and then deny a whole hospital stay because you just don't want to pay it. It's unfair for hospitals, if you really think about it.
Something you said, Helen, reminded me of work we've done before. So we came into your clinic and trained your staff a couple of times, right?
Yeah.
And so the staff at healthcare clinics, they're people who live in the community, right? They reflect the culture, the language, the fears. We know that healthcare providers, nurses, and medical assistants have not 100% taken the COVID vaccine, for example. So I bring this up because I think that some of the people who are listening in on this call, they could really, we could help them prepare some educational information for a healthcare provider group. And it could be a combination of the science, if you will, but it also can be what Reverend King talked about. And here's what the community has. So I just throw that out there as
and I think, Laura Lee, I think someone in the chat wrote about the toolbox. And I don't know how many of our attendees have gotten the toolbox. I know at Blessed Soul we did, and it was very useful because, you don't have to kind of reinvent the wheel. And I wasn't kidding that I was going to steal some of Kristen's.
No, we're going to put them in there. So the toolbox,
because the
sign up, it's all free.
And little things like that, because I have to tell you, I'm not the best at social media. And the fact that she was able to do, I didn't even know PowerPoint could do that, embed a video within PowerPoint. I thought that was so cool. But it's little things like that, little tips that make it easier for you to educate and connect more. And, at the end of the day, it also helps you save money because you can't get a vendor to do it. So I think, that's an extra additional resource that you can use for training your staff and making things more interesting. And, training is important, training and education of your team. And
you don't have to build it from scratch, like you said. We have it all there.
How many languages we speak at Elmer's? We speak over 125 languages, and we represent 98 different cultures and religions inside our hospital walls.
So we need all of those folks to have resources. I want to throw it over to Shanina again, because you've been hearing us talk about ways to kind of make a difference and apply this wonderful stuff. So one thing that was hitting me, Shanina, when you were talking is that, we all kind of have these activities or professional lives, and we come up with a question or we have a good idea and it works well. We are sharing your fantastic infographics in our free toolkit. Everyone just sign up and you get everything for free. But I wonder if there's a way we could really kind of put together a board that we could, not just frequently asked questions, but something along that line. Tips on how I dealt with this question, or here's a resource. I'd like to kind of add that to our toolkit because it's amazing as we as champions go out there, we each can teach somebody else. But anyway, can you further discuss the issue of what other people can do, how they can bring your work to shine?
That is so nice of you. So this is definitely different. And as you mentioned, not my direct line of work, but something that I feel is of necessity, especially with what we're going through right now. And I can imagine just with all of us right now and our expertise, Reverend King, I'm sure just with the mental health issues and just I would say the stress that COVID has brought amongst us, being able to really, truly use your expertise in a manner that, spans beyond your congregation and the people that you would normally service. And so for me, what I have done is I have put a website up, and it's Prevention Saves Lives, and I'll type it into the chat box. But essentially what I try to do is put up resources there. I try to post on social media regularly. Individuals, they will constantly DM me on Instagram with questions, and they're specific, you know. Me and my wife are vaccinated, but we was around our relative. What should we do that's unvaccinated who just found out they were positive for COVID-19? So you do have these questions, and they are specific situations that will come up for individuals that have never encountered, you know, things before. And I'm learning. And as I continue to learn and these questions come up, I add them to my toolkit, because if one person has that question, then
Right.
9 times out of 10, someone else has that question too. So when it comes up, I'll just put it out there, you know, let's say on social media, or if it's not on social media, this is actually what contributes to the infographics. Because I'll then go out into the community and I'm talking to people and I'll say, hey, you know, have you encountered this? Has this been your experience? How would you best explain it? So I'm talking to someone that doesn't have my level of expertise, but I want to hear from them as a community member. And I'm not going and asking someone, show me your resume. Let me see your credentials, what level of education you have. I want the everyday Joe. And that's who I want to talk to, because these are going to be the individuals that will be with their family members. These are the ones that we're going to see, you know, at the parties. I mean, I'm just being honest, like, you know, everybody's coming out now. A lot of these guidelines have been lifted. And so if you can't reach those individuals, we have to realize that just like we say many drops make an ocean, many individual COVID cases makes a pandemic, you know? And so when we recognize people as being people and on an individual level, and we're having this dialogue and these conversations, and then they're able to share, whether it is through their social media networks or with their friends, it's different. So I always carry these in my car. And I'm talking about, I could be going to get a car auto detail. I can go drop off a package or anything, and I'm literally passing a stack of these and saying, please pass these out to your family members, because, you know, right now we got the vaccine, which is absolutely great. There's some information in there about it, but you also need information on how to still continue to stay safe. Infection prevention is our new way of life. Anyone that thinks that this return to normal is getting ready to be anything that is short of including hand hygiene, short of making sure that you are conscious about the elevator buttons that you're touching, or the escalator rails, and checking the air quality and checking for dense populations of individuals that, you know, are not masked or potentially unsafe, then we would be crazy to think that we can return to that. This is the first time that people are aware of this bug, but this is not the first bug, and it won't be the last bug. So I always emphasize to individuals that when we share information, continue to share, continue to spread it, and don't be selfish about it. So I'm always going to share the resources as much as I can, because it's going to help somebody else. And while Helen may deliver her message her way, how, you know, she's saying like, wow, Kristen, I love the way that you delivered those slides today. We all may have the same message, but the way Kristen delivers it may resonate with an audience. The way Helen delivers it may resonate with an audience. The way, you know, Reverend King does it, you, Laura Lee, all of us are going to deliver the message, but it's going to be in a different manner that's going to hit different with someone. And I think that is the key.
We're at the last minute, and I just want to like build on a couple things you said. First of all, you heard a very simple idea. You could go and register on our site and print out infographics, put them in your car, and whenever you go somewhere, you can hand them out. I mean, that is a simple champion activity. Somebody asked a question, can you help us build a website? What you will learn about us, and I think everybody on this call will agree, is we almost never say no. We will try to help you do what you want to do. It's free. All you need to do is register. And just to Shanina's last point, every one of you have a voice that can reach some group that is different than, that is unique and important. We want you to send us your voice. Send us your tips. Tell us what you're doing. Email us your little videos, because everyone has a way of kind of getting the message across of helping people to protect their health. We're at the end of our hour. We could keep going on. I have the best friends and colleagues with Shanina, Helen, Terrace, and Kristen, and Kiko. I thank all of you so much for your time and continued work. I thank everybody on the call. Please sign up. It's free. Lots of resources. We'll help you one-on-one too. And have a great weekend. Bye-bye.
Bye.